The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Welcome to the Dr. Fazil Show. My name is Wendy. We're here with Dr. Fazil today to speak a little bit about kidney disease and dialysis. Dr. Fazil is an award-winning doctor here in Yuma, Arizona. He has won the Most Compassionate Doctor Award for 3 years straight. He has just recently been awarded the top nephrologist. He is a practicing internal medicine doctor as well as nephrologist, which is a kidney doctor. Thank you, Dr. Fazil, for giving us this time today.
Thank you so much, Wendy, for having me today. I'm very pleased to be here.
Yes, Dr. Fazil, can you tell us a little bit about kidney disease? How easy is it to test or know if you have any kidney problems?
That's a very good question, Wendy. The kidney disease is generally means when the kidneys are not working at their full capacity, and there are various kind of kidney problems like blockage to the urine flow can cause kidney disease, or blockage to the blood flow. Certain kind of inflammations in the kidney can cause kidney function dysfunction, I would say that rather. And with advanced technology, it's very easy to diagnose early enough that you do have a kidney disease through the blood test. In the nutshell, when the kidneys are not doing what they're supposed to do, that means filtering the blood, it will become obvious on the blood test, and then we can say that patient have kidney disease.
And how about, can you tell us a little bit about the treatment for kidney disease? What kind of treatments are available?
I understand that. So the answer would be it depends on the underlying cause. So if you have, for example, poor blood supply to the kidney, then adjusting the risk factor so we can improve the blood flow. If it's too much blocked, then putting a stent in the blood supply to the kidney. If there's a blockage to the urine flow due to kidney stone or enlarged prostate, medication to adjust that, or to mechanically or through surgically removing the blockage would be another option. In certain kind of inflammation disorders, doing anti-inflammation medications can cause improvement in the kidney function. In some cases, certain medications like painkillers, for example, ibuprofen, Motrin, Aleve, or naproxen, is one of the very common cause of kidney damage, and avoiding that would help as well. We can also adjust the diet. Low protein diet is good for the kidney, and we do advise our kidney patient to follow that diet, and that also helps. But obviously, there's so many conditions that it would be hard to enlist them in this interview, but this gives a general idea that knowing that somebody have a kidney disease is the first step, and then second step is finding what kind of kidney disease they have, and then the third step would be treating according to the problem, and obviously follow up after that.
Oh, thank you. And do all patients with kidney disease end up taking dialysis, or what is dialysis?
So not all patients end up on kidney dialysis. Most patients, if they see kidney specialists early enough, we can either stabilize the kidney function, and in some cases we can even reverse it or improve it. So kidney dialysis is probably the last option. That means kidneys are irreversibly damaged and there's no recovery possible anymore. So or sometimes we do it for a temporary reason too, and then the kidneys do improve. But in a chronic kidney disease, generally is a long-term treatment is dialysis or kidney transplant. And I think on that note, I would say that early intervention is the key, because There are 5 stages of kidney disease. Stage 1 is normal, stage 5 is when somebody needs dialysis. So if we do intervene them at stage 3 or stage 2 versus a stage 5, which is kidney function less than 15%, that's where the dialysis is indicated. It's a lot more easier to intervene at earlier stages, which is recommended, or even prevent it if we can prevent it.
Can dialysis be done at home, or does it have to be done in a hospital?
Indeed, that's a very good question. So there are two kinds of dialysis. One is known as hemodialysis, and one is known as peritoneal dialysis. Peritoneal dialysis is done through special fluid. We call it PD fluid. It can be done manually or through a machine, but it is done at home. And hemodialysis, generally speaking, although it can be done at home in very special circumstances, it is done at the dialysis centers. It is generally done 3 times a week through drawing the blood and running through the machine and putting back into the body through a catheter or through a special artery or vein. We call it a fistula, which is generally done by the surgeon on the arm, and it helps to connect the patient to the machine, and it's generally 3 to 4 hour process every other day or 3 times a week, and it's done in the clinic.
Once a patient is on dialysis, is it usually long-term?
Unless they get transplant of the kidney, it is generally the long term, yes. If it is chronic kidney disease, again, if it's acute kidney disease, that means something happened overnight, like infection or blockage, and they have to have dialysis. It could be for a few days or a few weeks, and if they improve kidney function, then it could be stopped. But 95% of the cases is long term. That means the kidneys has totally being unfunctional or dysfunctional, and they have to be on dialysis the rest of their life.
Thank you. And you stated that you could also have a kidney transplant. How many patients on average need a transplant? At what stage do they decide that that's the last resort?
Well, if they have a chronic kidney disease and they do not have any contraindication, which is like if they don't have any active infection or cancer or any other, there's a list of contraindication. Sometimes age, certain age limit. Each center have different age limit. Some centers have 70 years or more. They wouldn't do the transplant. You could get kidney transplant if your kidney function is less than 20%. And generally, the recommendation is to get a living donor, particularly the family donor from the family members, because of good match. That's recommended, but if you cannot get it, then they can be on the list for kidney transplant, which is known as cadaveric list, and they could get a transplant from a cadaveric donor as well.
Okay. And how long does it usually take to get a kidney transplant if you do not have a family donor?
So if you do not have a family donor, then most likely you're going to have a cadaveric donor or a donor from a dead person. There's a long waiting list, unfortunately, Wendy. The average waiting list in USA is around 5 years. So that means that you have to be on dialysis for at least 5 years before, and if you're in good health and there's no contraindication, at that time you can get a kidney transplant.
Can you go on the waiting list? Can a patient go on a waiting list prior to actually needing a kidney transplant?
That's a very good question. In my practice, I have done it numerous times. As said, the dialysis is indicated when your kidney function is less than 15%. But you can qualify for kidney transplant if your kidney function is less than 20%. That means if you're in stage 4 as opposed to stage 5, you can be on the transplant list. And I have seen in certain cases where I have put patient on transplant list way before they needed to go on hemodialysis or dialysis, and they got dialysis before they got transplant before they needed dialysis. And so the trick is that if if the kidney specialist is aggressive enough and knowledgeable enough, and they can start the transplant process at a stage when they're 20% or less. Then it has to be 15% or less. Yeah.
That will significantly shorten that wait time, correct? Or give them at least a jump start?
It will give them. They will buy time. So let's say if you can buy 3 years or 4 years and keeping them away from dialysis by putting on the list, even if they go on dialysis, they're already 4 years on the list, and then just 1 year on dialysis, and they would be eligible to get a kidney transplant. So that's always a winning strategy.
And is a kidney transplant covered by insurance, or how expensive is that for the patient?
Kidney transplant is covered by insurances. I mean, if they have insurance, yeah, they will cover it. I mean, if they don't have insurance, obviously they will have to self-pay. But most patients who are on dialysis, they go on Medicare, and they would need, that will cover the transplant, but they'll have to have a secondary insurance to cover the 20% remaining. And if they do have it, it makes it easy. If not, there are different government programs which can help out, or they have to pay out of their pocket to cover the 20%. But it's still more cost effective to be on transplant versus being on dialysis, because dialysis is a lot more expensive than the cost of the transplant.
Thank you, Dr. Fazil.
You're welcome.
Dr. Fazil, how can a patient find out if they have kidney problems?
Well, Wendy, that's a very good question. It's actually a kind of educational process. So it can be very easily found on blood test. Blood test is commonly done for different reasons. Most of the blood tests do include kidney function. So if the primary care doctor is vigilant, they can easily recognize if patient have kidney problem, and they can refer the patient to the kidney specialist. And I will also advise to my audience and to the patients that they should be also more proactive and ask anytime if they have a blood done, that if they have a kidney problem or not. And if they do have a kidney problem, they should be referred to a kidney specialist so they can intervene early and prevent the next stage of kidney dysfunction and prevent dialysis.
Dr. Fazil, can their regular family doctor provide enough care with a patient, or for a patient with kidney problems, or should that be directed to the specialist?
It depends on the comfort level and training of the internal medical specialist or family medical specialist. If they're trained on, or if they have enough training or awareness, then they can do it themselves. But if they don't, then there would be no harm in sending it to the kidney specialist to save the patient's kidney.
Okay,
And better management.
thank you.
You're welcome.
Thank you, Dr. Fazil, for taking your time today to speak with us and educate us on kidney disease and kidney dialysis treatments and transplants. Stay tuned for our next segment.
Thank you so much, Wendy, for having me here today on this show, and thank you so much, everybody. And I hope my answers to your question did help the audience, and we'll see you guys again. Have a nice day, guys.
Thank you.
Thank you. Bye.